the course is going to be divided into introductions to general pathology, then microbiology. Introduction to general pathology and microbiology. What is pathology in general? When we say pathology, what is it are we talking about? It refers to the study of the structure, biochemical, and functional changes in a cell, tissues, organs that underlie disease. It serves as a bridge between the basic sciences and clinical medicine and is a scientific foundation for all medicine. What we are trying to say is, in simple terms, when we say pathology, we mean the study of disease causation, the study of disease causation, that is what causes disease. Then in case of disease, how do cells change? So we also look at cellular changes, generally tissue changes in the presence of disease. How do we even investigate for that disease? And we continue even up to what happens after death. So what happens to the cell after it has died? Can it help us tell what has killed the person by the study of the cells or tissues? So all that entails what we call pathology. Like in summary, I've said disease causation. So we are going to study all things that cause disease. Pathophysiology, how do cells change? How do biochemicals change? Chemical analytes, how do they change in presence of a disease? How do we investigate it? All that entails pathology, and it makes the coverage, our coverage of what we are going to study in the whole course unit of general pathology. So the study of pathology is divided into general pathology and systemic pathology. General pathology means general features of how the cells or tissues respond to injury, respond to disease. That is general pathology. Then systemic pathology, it is now about your body systems, the cardiovascular system, the endocrine. We may not be lucky enough to cover that because I don't think it is provided for in your syllabus. But what is provided for in your syllabus is the basics, generally speaking, in presence of disease, how do your cells change? Okay. Like I told you earlier, the four aspects of a disease process that form the core of pathology are the cause, the pathogenesis, the changes, and the clinical manifestation. All that make up pathology. So what causes disease? Many diseases in humans do not have a single cause. Most of them, such as atherosclerosis and cancer, are multifactorial and arise from the effects of various external. Well, the summary of this is you can categorize causation of disease as microorganisms, congenital anomalies, physical injuries. All those are causes of disease. But many diseases do not have a single cause. You find that their causations are multifactorial. For example, atherosclerosis. Atherosclerosis means accumulation of cholesterol in your arteries. It does not have one known cause. It may have a familial cause, a familial predisposition that once you have that disease in your families, you are most likely going to develop it. But then another cause would be uncontrolled or inappropriate consumption of lipids. So you see, many of these diseases have a combination. Okay. Then we go to the subspecialties of pathology. We have cellular pathology or molecular pathology, to those of you who want to specialize in molecular sciences. Then we have histopathology. That one is checking the morphological changes of cells in the presence of disease. That includes what you commonly hear as a biopsy. They are taking a biopsy. So what we examine for and a microscope is to see how your tissue is changing in the presence of disease. Then we have cytology. Cytology means we aspirate fluid and look at individual cellular changes. Then we have forensic pathology, that is to investigate causation of death. Then we also have microbiology, which is a study of infectious diseases and their causes. This can be subdivided into bacteriology, virology, mycology. So that one is also under pathology. Then we have the study of blood and blood forming, the diseases of blood and blood forming organs. That's what we call hematology. Then we have chemical pathology, that is a study of chemical analytes to determine the disease. All those are subunits, are subspecialties of pathology. Even immunology, the study of diseases in your immune system, is also under pathology. But as you can imagine, all that is too much. Therefore, not all can be given to you. We shall choose out a few that we think you need. For example, we shall not take you to forensic medicine, how to do autopsies, or what you call post-mortem. We shall not go there. As much as it's a subunit of pathology, we shall not go there because your training would not allow you to practice there, for example. So generally speaking, that is an introduction to pathology of what it entails. So we are going to start by looking at general characteristics of cells or tissues in the presence of disease. So we are going to look at what we call cell response to stress and noxious stimuli. If your cell is injured, if your cell is exposed to an injurious stimuli, how does it respond? So we say the normal cell is confined we are saying the normal cell is confined to a fairly narrow range of function and structure by its state of metabolism, differentiation, and specialization. It is able to handle physiological demands, maintaining a steady state called homeostasis. What I mean is, normally, your cells live in a regulated environment. There is a predetermined or inherited or congenital capacity to maintain the environment around your cells. Your cells live in a way that those that die are replaced by other cells that you even do not realize. So that controlled cell death, controlled cell repair is an innate mechanism that you don't realize at all. So in your life, you do not know that you are losing cells. You are actually losing cells to so many noxious stimuli, to food, to infection, to radiations, but you never realize it because there is a steady state environment, and that's what we call homeostasis. But then there is a time when the normal regulatory mechanism, when the homeostatic environment gets overpowered, and your cells have to either adapt to that environment or they die. So generally, the response of your cells to an injurious stimuli can be an adaptation to that environment. They adapt to survive in that toxic environment, or they die. And if they die, we have got what we call programmed cell death or accidental cell death, unwanted cell death. Unwanted cell death is what we call cell necrosis. Programmed cell death is what we call apoptosis. So now apoptosis is the inborn. It is the inborn mechanism that determines cell death of overgrown cells. Cells which are no longer wanted in your system, they die, and that one is called apoptosis. And in fact, should you have a failure of that normal cell death, of that apoptosis, then you have accumulation of abnormal cells. The cells which were injured, that were supposed to have died, if they fail to die, then they get accumulated. And that is how probably other people develop cancers. And that is failure of apoptosis. So we are going to look at some adaptive mechanisms of your cells to injury. How do your cells adapt to injury? Cell adaptation. Number one is what we call hyperplasia. Hyperplasia means that your cells have gotten exposed to an injurious stimuli, to a toxic environment, but in a way to adapt to survive, they increase in number. They increase in number, and we call that hyperplasia. So hyperplasia means cell increase in number. This hyperplasia can be secondary to physiological or pathological events. So the first assignment of today, and you should have heard from your the previous classes, that what I take as your test is you handing in my assignments. So today's first assignment is you go and list all causes of physiological hyperplasia and pathological hyperplasia. What is it that causes your cells to increase in number, but it is not a disease? Okay, let me give you an example to just guide you. Like in pregnancy, you have the cells of the breast glands increase in number. Your breast was small. When you get pregnant, it becomes big. That is cellular hyperplasia. That is physiological. Same applies to the uterus. So that is physiological. But then you can have pathological. So pathological hyperplasia, you're going to look at an example is endometrial hyperplasia. You have seen peri or postmenopause women having abnormal vaginal bleeding because their endometrium, the cells in the glands of their endometrium have increased in number. That is pathological. So go on and list more of the examples of physiological hyperplasia and pathological hyperplasia. Another cell adaptation is hypertrophy. Now, hypertrophy, the cells have not died, but have increased in size in a way to adapt to that bad environment, to that abnormal environment. Again, this hypertrophy can be categorized as physiological hypertrophy or pathological hypertrophy. You want me to give you an example? Because you are also going to go and list that in assignment. But if I can give you an example of the physiological hypertrophy, you have seen weightlifters. Look at their biceps, look at the muscles on the chest. So that enlargement of their muscles following repeated exercise is an example of physiological hypertrophy. But you can have a pathological hypertrophy also. Say, for example, you have heard of what is called a fibroid or a myoma, when your smooth muscles in the uterus become thickened, become big, and they form a mass. Now that is pathological hypertrophy. Please go on and list more examples. Another cell adaptation is called atrophy. Atrophy means now the cells become smaller. They become smaller. Atrophic, becoming small. Again, we have got physiological atrophy and pathological atrophy. For example, physiological atrophy, loss of function. You may be there, you are not exercising your muscles at all, and what happens? The cells become your muscles become too thin, and you have a very thin limbs, thin muscles, not because they are sick, but because of inactivity. That is physiological atrophy. You can have a pathological atrophy, like poliomyelitis. You have a disease process, an infection that affects the nerve supply to a particular muscle, like it happens in polio, and the muscle that was supplied by that nerve becomes atrophic. Another adaptation is metaplasia. Metaplasia means the cells change from their normal shape to another shape, just in a way to survive in the toxic environment. You remember the types of epithelium? Don't forget the types of epithelium: the squamous epithelium, columnar epithelium, or transitional cell epithelium. The type of epithelium can change from one to the other in a way to survive. The commonest example of metaplasia is seen in the lower part of the esophagus, where we know the lining of the esophagus is squamous epithelium. But supposing you have got continued reflux, what we call reflux disease, gastroesophageal reflux disease, that acid is refluxing from the stomach back to the esophagus. What happens? The epithelium of the esophagus will want to adapt to a way to survive in an acidic environment. The acidic environment in the stomach, the stomach is lined by secretory epithelium, coromuna. So if this acid keeps refluxing to the esophagus, the epithelium of the esophagus will want to look like the stomach epithelium in a way to survive the acidic environment. So they acquire that shape of columnar epithelium. So you get now what we call metaplastic esophagus, what is called Barrett's esophagus. We're going to find out what Barrett's esophagus is. Barrett's esophagus means the squamous epithelium of the esophagus have changed to look like the columnar epithelium of the stomach in order to survive that bad environment. Unfortunately, it is a pre-malignant lesion. Whenever you develop that, you are in a way to develop cancer. When the stress is eliminated, the cell can recover to its original state without having suffered any harmful consequences. But if the stress does not go away, then the cells can go on and be injured. You get what we call cell injury. Now, that cell injury can be reversible or irreversible. You can have your cell adapt. There are three ways I've said. You can have your cells adapt by those mechanisms I talked about. You can have your cells injured, and if it's injured, the injury can be reversible or it can be irreversible. And the irreversible cell injury is what we call cell death. And I told you cell death is divided into two: accidental cell death, unwanted cell death, what we call necrosis, then programmed cell death, the innate cell death, good cell death, if you want to say, what we call apoptosis. Okay, so the unwanted cell death, the one called necrosis, has got different features, morphological features. How do you know the cells here have died? How do they look like? So we look at morphological features of necrosis. Morphological, if the cells have died, how do they look like? So there are different morphologies of tissue necrosis, and one of them is coagulative necrosis. Coagulative necrosis, we mean the cells have died, but they have maintained a solid state. So you find tissue death, but with a solid state. They have maintained a solid architecture. That one is coagulative. If you have had things like dry ganglion, for example, myocardial infarction, when the muscle of the heart dies, it does not melt. It remains in a solid state. So that is coagulative. Then we have what we call liquefactive. Liquefactive means the other dead tissue gets digested by microorganisms and it forms like pus. So pus formation is liquefactive necrosis. If you have heard of something called wet gangrene, is an example of liquefactive necrosis. Then we have got, well, this gangrenous necrosis actually follows in the category. If it is dry gangrene, it is coagulative. If it is wet gangrene, it is liquefactive. Then we have got what we call caseous necrosis. Caseous necrosis is typical for tuberculosis, TB infection, and for it, as the name goes, caseous means cheese-like. It is not solid, it is not liquefactive. It is like a gel. It is like chime. So that is caseous, and that is typical for tuberculosis infection. Then we have got what we call fat necrosis. Did you know that when the parenchyma, when the cells of your organ die, they can become replaced by fat? You have heard of things like fat infiltrate of the liver. So you can find what was a solid organ has all become fatty. That is another type of necrosis. So fat infiltration or fat replacement of your normal cells is another example of necrosis. Then you have got what we call fibrinoid necrosis. Fibrin to mean fiber-like. Bread and butter is an example. You have seen how bread and butter relate. You want to try and separate two pieces of bread when there is butter in the middle. What happens? That kind of fibrinous. That is another type of necrosis, and we see that on the heart, on the outlining of the heart called the pericardium. That's where we commonly see that type of necrosis, and in the blood vessels. So young friends, that one marks the different morphologies of necrosis. I want you to go and read in your books what is apoptosis, or even on the internet, read about apoptosis and understand, differentiate between accidental cell death, which is necrosis, and innate or programmed cell death called apoptosis. So go and understand what is apoptosis. For example, ask yourself, why doesn't your tongue grow to protrude from the mouth? That is apoptosis. That means that cells reach somewhere and they have to stop. There is natural death. Why does a gravid uterus which was full of fetus, when the fetus is delivered, how does it go back to become a wrist size? How does it become small again? That is apoptosis. As you can imagine, failure of apoptosis would make you to develop an abnormal mass of tissue which can result into cancer. So that death, the shedding of unwanted cells genetically, is what we call apoptosis. But if your cells die because they have been injured by different things, is it heat, is it chemicals, is it microorganisms, then it becomes necrosis. You are trying to ask something?
So I was requesting for clarification about the work you've given us, the assignment.
Okay, I'm saying the first assignment of the day, I said go and list physiological and pathological causes of hyperplasia, hypertrophy, and atrophy. You see, there are three adaptations, cellular adaptations to injurious stimuli: hyperplasia, hypertrophy, and atrophy. Now go and list the physiological causes and the pathological causes of each. Write them. You can write them with your ink and paper or type them. Please don't go to the textbook or to the internet, copy and paste. Whenever you do that, I put 0. And I'm not saying you hand in that. Just write that as assignment number 1, keep it. By the time we finish our course, I will have given you about 8 or 10 assignments, and you hand them in at the end of the course, and that will work as your continuous assessment. Okay?
Okay, sir.
Yeah.
Okay, sir. Thank you so much.
Okay. And I hope you can access the notes, isn't it, Doreen, on this platform? Can't you access the notes?
Sir, we can, as well